Hi, this is Nathan Yokel with Regenerative Orthopedics. Just wanted to touch base with you about a common problem in a patient we saw at the clinic today and that we're treating, and that may be something that comes up more often than we would think in life and in medicine. A lot of times when patients have symptoms in their back and down their leg, pain, numbness, tingling in their leg, we just assume that that's coming from the spine and you have a disc issue or sciatica. But your sciatic nerve may start in the spine, but it runs all the way down your buttocks and down your leg, and there are other points where that nerve can get entrapped. One region that is commonly irritated is your piriformis region. Your piriformis muscle runs from your sacrum down to your hip bone, and it helps stabilize the back of your hip. When this muscle is tight, the sciatic nerve runs right by it and can get irritated. As that muscle gets overgrown, as there is fibrosis around it, it can irritate the nerve and mimic some of these sciatic nerve symptoms. Now, normally when this happens, it's a breakdown from other weakness patterns. We have chronic sacroiliac joint dysfunction, where your spine meets your pelvis. We have gluteal tendinosis and weakness. If these gluteal muscles are not doing their job, when you're standing on one leg, you would bow out like this. Your body doesn't want you to do that, so that tension is placed in the sacroiliac joint and ligaments. If the sacroiliac joint and ligaments are irritated or injured, your piriformis muscle will spaz out to help support you so you don't fall out like that. So now you have this tight muscle that is holding on and is irritating the nerve. So in order to alleviate these symptoms, rather than doing an epidural in your back, we will do a treatment where we find the nerve under ultrasound. We take a layer of fluid and under ultrasound guided injection, put a layer of fluid all the way around that nerve and take the needle and poke some little tiny holes in that fibrosis around that area. That will alleviate the tension on the nerve, and for many patients will take the tension off those symptoms. However, if you are weak when we do our testing, what is to stop that tension from just coming back? The muscle will get tight again, the nerve will get irritated again. So sometimes we use some of our regenerative reparative treatments, such as the plasma-rich and growth factor, such as prolotherapy, and even some of our advanced cellular treatments to try and stabilize things first. We're stabilizing the gluteal tendons, the sacroiliac joint and ligaments, and the lower ligaments around the piriformis so that everything is more stable. If we get everything more stable, that muscle will loosen up and take tension off the nerve. So sometimes we're able to alleviate these symptoms without doing that loosening or hydrodissection of the nerve, just by building stability. So these are some ways that we treat Piriformis Syndrome, which often mimics sciatic nerve pain down your leg. The number one way we treat it is with physical therapy and strengthening your lower core and pelvis, strengthening your gluteal muscles, stretching and loosening up the tension on that nerve, doing flossing or nerve guide exercises. But when that fails, that's when we reach for these injections, stabilizing with regenerative reparative treatments, or eventually loosening tension with nerve hydrodissections or ultrasound guidance. All these procedures are safe. They are done same day in the office, and you go home afterwards, and they have a brief recovery. So I hope that's some good information for you. There's more information on our website, and if you have an issue that seems like this, come see one of our ROSM doctors near you.